Hello everyone, this is Jin, a TCM practitioner and instructor in Victoria, BC, Canada. Here is my online class for Pathology. This class is specially for TCM students. The book we used I put below here. I hope I can help the students to study and review for the class. Okay, let's start. Okay, let's discuss chronic bronchitis. So chronic bronchitis is one kind of COPD. I believe you heard about this word, COPD. That means chronic obstructive kind of pneumonia disease. It's a lung issue. Yeah, it's a lung issue. So basically, people have chronic bronchitis that usually cause long-term problems. Inflammation happens in the bronchi tree, in the bronchi tubes, and they will have a lot of mucus. And the mucus in the bronchi tubes will cause people cough and also difficult breathing. So that's mainly clinical symptoms. It's a chronic process. People chronic cough and chronic difficult breathing. So reason causes. We're talking about smoking. Yes, smoking is the mostly commonly reason. Yeah, people smoke for many years and cause the bronchi tree and the tubes some injury in there, and then they will produce this big amount of mucus, and the mucus blocking the bronchi tree, blocking the air passing the roof. Then people difficult breathing. And some other reasons still possible caused by air pollution and some special kind of dark. Basically, it's long term and then cause the people sick in the lung. Chronic bronchitis, we say cause problems. Mainly people cough and difficult breathing. So like this picture here, so we take small pieces of bronchi tube from here, from the lung here, and make it enlarging here. So healthy condition, you can see like inside of the bronchi tube. It's pretty bigger. So that allows a lot of the air passing, oxygen passing, and the thick or inflammation kind of bronchitis, like a bronchi tree. You can see inside the diameter here is pretty narrow. So like this one, normally we have this bigger, like a diameter kind of tube to allow the air passing, but for sick patient, only have this bigger. So that certainly cause people severe kind of difficult breathing. So that's mainly in pathology part, the structure changing. And they also have some cells metaplasis in there. When we're talking about healing, when we're talking about the self-injury, when we're talking about self-injury, so after self-injury, we have some adapted will be happen. And one kind of adapted is the metaplasia. So metaplasia is used other cells instead of original cells. So that means they losing their some function in there. And also on the wall part, some fibers in there. So that's basically in the shape part, the bronchi tree, some changing in there when chronic inflammation happens. So clinical symptoms, lung issue, mainly they will have two key symptoms. One symptom is cough. Another symptom will be short breath. So most lung issue, they will have these two key symptoms there. So people cough and cough out a lot of phlegm. Because they producing a lot of mucus and they cough out a lot of phlegm. And it usually is clear color, clear and white color. And if some other like bacterial or virus infections happens, the color may be changing to yellow or even green. So that's usually happens. So generally say if patient clear white color, that's during like chronic time, but plus some bacterial infection, virus infection, their color will be changing to yellow or green. That means most severe kind of infection in there. And another key symptoms, short of breath. So that's some key symptoms here. And certainly patients feel fatigue. When people sick for long term, people will feel fatigue. And slightly fever and chilled, that's usually get EPI attacking time. It's not like always fever chilled in there. So we say that's chronic process, but the patient easily getting common cold. During they getting common cold, they will chill and fever. And possible some chest air discomfortable. Maybe not sharpened. Maybe just feel some pressure in there. So kind of uncomfortable feeling in the chest. So when we diagnosis for chronic bronchitis, usually if you go to the GP, go to doctors, they will diagnose it for you. Some people continually like a cough 3 months and at least 2 continually year. So generally say chronic bronchitis is kind of a seasonal kind of illness. Patient more worse in the winter time or maybe spring season and getting better in the summer. So that's usually when winter coming, people will be start cough, 3 months, and then when weather getting warm, they stop cough. And the next year, same time, start cough again. So if they continue like 3 months symptoms show up and continue like 2 years, it will be diagnosis for chronic bronchitis.